celebrating today the ribbon cutting of the Okatie location of Your Health with the Chief Development Officer, Jason Taylor. Congratulations.
Thank you.
That's
Thank you.
wonderful.
We're so excited. We're finally getting to open.
I know. So this is the first day. Tomorrow you're going to actually have patients.
We're going to be...
And it's a primary care facility.
Correct. Yes, ma'am. We'll have our nurse practitioner, Jacqueline Taylor, and then we'll have, and then in a few weeks we'll have Dr. Cordero coming. But we hope to have it packed out with our members of Okatie and Sun City.
And so the services, so it's primary care, so you have the nurse practitioner, you have a full team.
We do.
So what kinds of patients would come here?
What kind? Well, really anybody. We're really looking for that 55 and older community, but we really want to be more proactive in the care. So what we're trying to do here with Your Health is really make healthcare more of a journey for the patient. So we want to get to that patient early so that we can help guide them through their wellness plan.
Right, and so it's really a partnership, isn't it?
It really is.
With your provider, and early detection and prevention and wellness, not just taking care of patients when they're sick.
True, and part of it is the care team model. So we have people like, we have health coaches, we have transitional care professionals, pharmacists, social workers, all of these people who will be part of taking care of those patients.
Well, it's a great day for Your Health.
It is. We're so excited. We're looking forward to it.
Danette Whitaker is the vice president over the clinics. Right now we have the Okatie clinic, and we hope to expand into perhaps Bluffton, even Hilton Head. Is that correct?
Yes, ma'am. We are currently looking at sites in both Bluffton and Hilton Head for a total of 3 clinics in the area.
So talk about the business of running these clinics and how streamlined you want that to be for the patient. It's all about the patient.
It is definitely all about the patient. We practice value-based care, and we put the patient at the center of the care. So in running the clinics, as the VP of the clinics, it's important for me to look at our processes, look at our data, and make sure I'm relaying the information down the chain to the rest of the staff at each clinic, so that we're keeping our productivity where it needs to be, and we're keeping the metrics for the patients where they need to be. So for instance, if we have a diabetic patient and they haven't been seen in a couple of months, for us that's a problem. So that's my job to identify, to find that, and to make sure I'm relaying to the staff that we need to get this patient in, we need to...
So Danette, if someone's a new patient, should they bring their medical records with them, or can you locate those? I guess it depends.
It does depend. We will start from fresh, so we'll gather all their history. If we can reach out to their previous primary care provider, we'll get that information, but we do a very comprehensive exam of our own to get the history, and then that's shared within our electronic medical record. So if they were to go, say, to the Hilton Head office one day to be seen, that they'll have that information.
Dr. Carlos Cordero will be the medical director here at the clinic. And what exactly does that mean, Dr. Cordero?
Well, I'm going to be actually be a staff physician here. I'll be seeing patients in this office. Your Health is running a new concept. We're not concierge with just the regular internal medicine primary care practice that is up. It's just open in South Carolina. In this Lowcountry area, we got this is the first clinic in the Lowcountry. The concept is that all the patients will have integrated care that will include primary care, physical therapy, occupational therapy, case management. So we have a comprehensive group that is going to be taking care of much everything for their patients.
So it's a full team approach.
Yeah, a full team. I supervise nurse practitioners, and I actually be the overseeing physician for the nurse practitioners, and I'll be taking care of my own group of patients.
Yes. There'll be 2 providers here at the Okatie location of Your Health. We will have a physician and, of course, a nurse practitioner. Jacqueline Taylor is the nurse practitioner.
Yes.
Congratulations
Thank
on
you.
the ribbon cutting today.
Thank you. We are so excited.
In your role. will be what?
Yes, so I'm a family nurse practitioner. I'm able to see patients of all ages from birth to, I've had a 106-year-old patient. So we see them and assess them, treat them accordingly, just like a regular doctor's office.
And then how do you interface with the physician?
So I'm going to work side by side with Dr. Cordero. I will be here all of February. He's going to join mid-March, and we treat together. So as a mid-level practitioner and provider, I can resume the role with treating, with prescribing, assessing.
So why do you think this is going to be a great location for your health here at Okatie, Bluffton area?
Yeah, I think it's going to be great because we're really I feel like in a lack of something needed for more primary care providers, and we can really see and treat everything. We are able to also take some walk-in patients as well as appointment scheduled patients, and it's right outside of Sun City, which is perfect. We said, come on in on a golf cart. That's great too. And then people in Bluffton as well, but hoping also to target all adult population, not just elder, 50s, 60s, 70s, but from all ages.
And then you can refer to specialists if that individual needs particular heart care, cancer care, whatever.
Absolutely. In fact, we have a cardiologist group. The main one is right downstairs.
That's right.
So cardiology, pulmonology, we are able to specialize as well and be able to coordinate care all together with those providers.
Well, it's going to be a great success.
Thank you so much.
Thanks, Jacqueline.